And now, Mr. President, I do want to turn to the topic of the overall health care debate that we're having in this country. For the past several weeks, I've been home in Wyoming, as you have been home in North Dakota, and I listened to the people that I'm so privileged to represent, many of whom I've been privileged to treat as their doctor. Of course, we discussed their health care. And as a doctor, I want to make care better and more affordable. Folks in Wyoming actually know me first as a doctor, so many of them call me Dr. Barrasso or John as opposed to Senator Barrasso. You see, people back home think of their doctors as members of the family, as friends, neighbors, live down the street, go to the same church, kids go to the same schools. And the local hospital, certainly in Casper, is right in the center of town. And people don't want that to change. They want the same people giving them care, but they want it at lower costs. And this holds true for the rest of the country. So people are rightly concerned. Americans worry that they won't be able to pay for their health care. Republicans are listening to these concerns, and we are focused on lowering the out-of-pocket cost for people's health care. That's why we ended the unfair Obamacare tax penalty. We have ended that. And we recently banned these costly drug price gag rules, so people could know actually what things cost and what the best deal was for them. Now we're focused on ending something called surprise medical billing. It happens, Mr. President. Huge medical bills that you don't expect and you can't easily pay. We're also moving more measures to lower drug costs, drug prices that people actually have to pay. Here's the problem. Democrats are rejecting all of our efforts. They're proposing costly health care, to me, schemes. The Washington Post reports that 5 of the 7 Democrat senators, members of this body, 5 of the 7 Democrat senators who were running for president have backed a one-size-fits-all approach. The government, it's a government-run plan they call Medicare for All. And the Washington Post reports that a majority of House Democrats also back it and have actually co-sponsored it. They want it to become the law. The Democrats' proposal would take away on-the-job health insurance from 180 million working Americans. Let me repeat that. What the Democrats are proposing with their so-called Medicare for All, a one-size-fits-all proposal for health care in this country, would take away the health care that people get on the job, that they've earned on the job, and there are 180 million people that get their insurance that way in America. Now, the cost of their proposal is $32 trillion. That's trillion with a T. It's an astronomical amount of money. Of course, they'd have to pay for that, as Senator Sanders has said, by raising taxes on the middle class. These Democrats clearly aren't focused on helping lower the costs of care. They're too busy, in my opinion, with plans to destroy health insurance, destroy union workers' hard-fought insurance benefits, destroy the current Medicare program for 60 million seniors, and destroy the health coverage that people have earned at work. And for what? All so government can have complete control over America's health care system. We can't afford for that to happen, Mr. President. Democrats have admitted that their Obamacare health care law has failed. Polling shows that the majority of Americans don't want a one-size-fits-all health care plan for them. Now, remember, congressional Democrats in the House and the Senate, when it came to the vote on Obamacare, promised that the Obama health care law would control costs. They actually named it, I think a complete misname, the Affordable Care Act. It was the Unaffordable Care Act. What we've seen is out-of-pocket costs have soared, insurance premiums have soared, all after the Obama health care law was signed. For many Americans, health insurance premiums have doubled since the signing of the Obama health care law. Monthly premiums often are more than mortgage payments. This cannot stand, Mr. President. Simply can't continue. We cannot trust Democrats to roll the dice again with the health care of the American people. Now, Republicans are focused on real reforms, reforms that actually lower costs, reforms that protect patients with pre-existing conditions. In July, the Senate Health, Education, Labor, Pensions Committee approved a measure to end surprise medical billing. It also includes language to bring down the cost of drugs. As a doctor, I know patients shouldn't stress over forms. When you're sick, you should focus on getting well. Care from an out-of-network provider can result in a big bill. It's called a surprise medical bill. You can easily blow an entire family budget. Patients shouldn't be pawns, really should not be pawns in this high-stakes financial chess game. So we're working with President Trump to end this unfair practice of surprise medical billings. It's the right thing to do for patients and for their families. Republicans are also making progress on lowering drug costs. We passed the bill I co-sponsored to end the drug price gag rule. And as a result, patients can always find the lowest priced drug. And we're continuing to work with the President on this and other issues. Still, to make more progress, we need Democrats' support and cooperation. The choice is clear. Work together to lower costs without lowering standards, or follow the Democrat senators running for president and House Democrats who are pushing for a one-size-fits-all government-run health care for America, with the loss of choice, the loss of control, all of the concerns that come with a one-size-fits-all government approach. Doesn't seem like they're for lowering costs. Seems that they're for raising your taxes and taking away your control and your choice. They're not for improving care. They're for increasing and growing the role of government. And remember, Democrats want to take away health insurance from 180 million Americans, working Americans, people who go to work every day and have earned their health insurance at work. At the same time, Democrats running for president are promising free health care. I was astonished, Mr. President, when I saw this in the Democrat debate, promising free health care for illegal immigrants. They want to take insurance away from hardworking Americans and give insurance free to illegal immigrants. What kind of proposal is that? Who is being represented by these Democrat senators and other Democrats running for president with this proposal? Who do you think is going to pay for all of this? Why should we pay more to wait longer for worse care? It's not something Americans want or will tolerate. Instead, let's give patients the care they need from a doctor they choose at lower costs. Thank you, Mr. President. I yield the floor.